Thank you, Mr. President. I would like to start by paying tribute to two of our humanitarian colleagues, staff members of Oxfam, who were killed this afternoon while on mission in Daraa Governorate in southern Syria. Mr. President, yesterday I met Dr. Armani Balour. She is a Syrian paediatrician who worked for 5 years in a hospital built underground to protect it against airstrikes throughout the 5-year siege of East Ghouta. She's the subject of a documentary film, The Cave, which was nominated at last week's Oscars. If you've not seen it, I recommend you do. Dr. Balour is a humanitarian heroine. Here is what she said to me, quote, "The same children I treated in East Ghouta are displaced again in Idlib. They are still under the bombs, still afraid, still without shelter, still without education. It's not life." End of quote. She described the situation of the newly displaced, sleeping in the streets, in the fields, out in the cold, with nowhere to go. Children are afraid, she said. They want safety, she said. Mr. President, I last briefed you on the unfolding humanitarian catastrophe in northwest Syria on 6 February. Since then, the horror has multiplied. At least 100 civilians were killed between 1 and 16 February by air and ground-based strikes in the northwest, according to the Office of the UN High Commissioner for Human Rights. 35 of those killed were children. More than 90% of these deaths occurred in non-government controlled areas. As UNICEF Executive Director Henrietta Fore has said, such abject disregard for the safety and well-being of children and families is beyond the pale. Blatant disregard for the life and safety of civilians runs contrary to the obligations that all parties must uphold under international humanitarian law and international human rights law. As Geir has just told you, front lines in Idlib and western Aleppo have moved swiftly. Advancing front lines have driven huge population movements in a matter of days as families try to escape the relentless aerial and ground bombardment. Over this last weekend, from 13 to 16 February, 160,000 people were recorded fleeing mostly from Atarab and Darat Azza sub-districts away from advancing front lines. And again, as Geir has said, we now believe nearly 900,000 people have been displaced since 1 December, most of them, more than 500,000, children. People are fleeing under horrendous conditions. Many are on foot or on the backs of trucks in below freezing temperatures, in the rain and in the snow. They're moving into increasingly crowded areas they think will be safer. But in Idlib, nowhere is safe. Almost 50,000 are sheltering under trees or in other open spaces. I am getting daily reports of babies and other young children dying in the cold. Imagine the grief of a parent who escaped a war zone with their child, only to watch that child freeze to death. As the Secretary-General warned yesterday, hostilities are now all around areas densely populated with the terrified people who fled. Those areas include Daraa and Samada in the direction of Bab al-Hawa border crossing. With the huge number of new IDP arrivals, Daraa now has a greater population density than the capital cities of many of our countries. And the number of new arrivals is growing by the day. If hostilities reach these areas packed with civilians, the human cost will be instant and huge. On 10 February, a child was killed and 2 others were injured in an airstrike on an IDP camp in Idlib's Kafar Aruk. On 14 and 15 February, ground-based strikes hit 2 makeshift IDP camps in the Samada area of northern rural Idlib, killing a civilian and injuring 9 others. As High Commissioner Bachelet said yesterday, no shelter is now safe. The bombing of women and children living under scraps of plastic sheeting and in freezing conditions is cruel beyond belief. We are still trying to count the number of civilians killed yesterday. Mr. President, we have today given new maps to all the relevant parties showing all the very large number of locations where we think displaced people who have fled now are. It is incumbent on all parties to protect these people. The mass movement of people into ever smaller areas of Idlib and Aleppo is placing immense additional strain on local communities. Most markets have closed. Available basic goods are prohibitively expensive. The price of basic goods has increased by 70% over the last 6 months. Since December, 72 hospitals, primary healthcare centres, specialised care centres and mobile clinics have ceased activities, collectively suspending the services of nearly 200 doctors, more than 300 nurses and more than 50 midwives. The maternity and childcare hospitals in Atareb and Idlib city, which provide life-saving maternal and childcare treatments, have stopped functioning. As Dr. Balour told me, with the closure of hospitals and medical facilities, many doctors have nowhere to work, even as needs grow ever greater. Humanitarian operations continue cross-border from Turkey to provide assistance. But, as I said before, the aid effort is overwhelmed. On 6 February, I briefed you on our appeal for an additional $336 million to help 800,000 newly or potentially displaced people over the next 6 months. Because of what has happened since then, it's now clear that that will be inadequate. In the next few days, we expect to publish a revised plan for some $500 million to assist at least 1.1 million people. Mr. President, we're considering all options to increase support into the northwest. We're working with the government of Turkey to expand the opening of the Bab al-Hawa border crossing to 7 days a week in order to increase the number of aid trucks coming in. We're asking the government of Syria for permission for a mission from Damascus to areas they have recently taken control of in order to see who is there and to assess their needs. Mr. President, 2 years ago, almost to the day, the Security Council voted in favour of a 30-day ceasefire in Syria. The Council's vote was unanimous, and the resolution expressed, quote, outrage at the unacceptable levels of violence, end quote. Is the violence we're seeing now not an outrage? I repeat again the Secretary-General's renewed call yesterday for an immediate ceasefire and for international humanitarian law to be upheld. Let me finish with a message from Dr. Balour. Quote, "We cannot wait. Every minute people are dying. The Security Council can help. The Security Council knows what is happening. They are watching, yet they do nothing." Thank you, Mr. President.